This is a presentation on the psychotropic medication Adderall as presented by Mary Kidd. The generic name for this medication is amphetamine mixed salts. The brand name is Adderall, and the class of medication is a central nervous system stimulant. And as you can see, there is the chemical structure of this medication. How does Adderall work? Specifically, it mimics the actions of the neurotransmitters epinephrine, better known as adrenaline, norepinephrine, and dopamine, although in higher quantities. At the same time, Adderall provokes some of the same reactions as the fight or flight chemical epinephrine. There is a rush of energy and clarity which focuses your attention and quiets your appetite. This is why some women take the drug to drop pounds. Similar to other stimulants like coffee, Adderall raises your heart rate and blood pressure. This cocktail of focus-boosting feel-good sensations gives your brain the impression that it's incredibly powerful and working at maximum efficiency. The best and simplest way to explain this to a client is that Adderall affects the chemicals in the brain and keeps the brain focused and free of distractions. I have included a picture of the brain with Adderall and the brain without Adderall. The red shows increased activity. As you can see, the brain with Adderall does have increased activity due to the fact that Adderall is a stimulant, as previously stated. Adderall is commonly used to treat attention deficit hyperactivity disorder, otherwise known as ADHD. Some symptoms of ADHD include disinhibition, hyperactivity, forgetfulness, disorganization, distractedness, and inattention. Other indications for Adderall include narcolepsy, which is a sleep disorder, and treatment-resistant depression. Adderall has a high potential for abuse and may be habit-forming if used for a long period of time. Abuse of Adderall may cause serious heart problems, blood vessel problems, or sudden death. Abuse can include taking a higher dosage than prescribed. The person taking the Adderall builds up a tolerance and needs more for the same effectiveness. The recommended dosage is no more than 40 milligrams a day. Some people like to snort the medication. This is popular among drug addicts and taking the medication to stay awake for long periods of time. College students will take the Adderall during their finals to stay awake. Taking someone else's medication, and using the Adderall for recreational use. Other things to consider when taking Adderall are that it can trigger mania or hypomania. Cardiac monitoring may be needed. It can cause increased intraocular pressure. It may lower the seizure threshold. It can cause Tourette syndrome or hyperthyroidism. And liver or kidney impairment may require dosage adjustment or discontinuation of treatment. As with any medication, there are some common side effects of Adderall. These include appetite suppressant or weight loss, wakefulness, heightened alertness, euphoria, impairment of voluntary movement, headache, irregular or rapid heartbeat. Adderall may cause nausea and vomiting or stomach pain. It might cause a skin rash. The person taking the Adderall may have difficulty falling asleep or staying asleep. And it also has the opposite effect at times. It can cause drowsiness, can make you nervous or restless. It can cause dizziness, and some people who take Adderall get dry mouth. With Adderall, there are 37 major, 466 moderate, and 14 minor drug interactions. Significant drug interactions include anticoagulants, anticonvulsants, beta blockers, caffeine, digoxin, MAOI antidepressants, other stimulant medications, SSRI antidepressants, thyroid medications, and tricyclic antidepressants. When combining alcohol with Adderall, people find that the depressive effects of alcohol are lessened. This allows them to drink for a longer period of time without getting sleepy. If you mix alcohol and Adderall, it can affect your cardiovascular system. It may increase the heart rate. So, if possible, avoid alcohol use, especially if you have a history of heart disease. There are 13 disease interactions with Adderall. These include cardiovascular, glaucoma, agitation, cardiac disease, glaucoma, hypertension, liver disease, seizure disorders, substance abuse, psychiatric disorders, renal dysfunction, tics, and diabetes. So, if you have any of these diseases, it's a good idea to let your doctor know, and an alternative drug can be prescribed. There are also a lot of food interactions with Adderall. As you can see, the list is pretty extensive. The main thing to note here is that any acidic uh, foods it has interaction with, because the absorption rate of the Adderall is less when you consume any of these food products. There are other things to consider when taking Adderall. Adderall can slow a child's growth if taken for long periods of time. So, as a parent, if you notice that your child hasn't grown in a while and the child is on Adderall, it's best to consult your doctor about this. Adderall is FDA pregnancy category C. What this means is that animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. Taking Adderall while pregnant could cause premature birth weight or low birth weight, or the baby can have withdrawal symptoms from the mom taking the Adderall while pregnant. It's best to store Adderall at room temperature away from moisture, heat, and light. And another thing to consider is if you're taking the medication late in the day, it can cause sleep problems. Here are a few interesting articles I found in regards to the efficacy of Adderall. The first article is one that we had to read this week. It talks about the difference in efficacy between Adderall and another drug called methylphenidate in ADHD individuals. It concludes that Adderall has an efficacy that's moderately better than that of methylphenidate. Another article I found interesting was on the mixed amphetamine salt extended release, which is Adderall XR or Max XR. If taking it in conjunction with an SSRI or SNRI for the treatment of adult ADHD patients who also have generalized anxiety. The last article discusses the efficacy and safety of the mixed amphetamine salts extended release, which is Adderall XR, in the management of attention deficit hyperactivity disorder in adolescent patients. Here are a few websites that I thought would be good if you would like to refer your clients to them if they're taking Adderall, if their child is taking Adderall. The first two websites other students have previously mentioned in other presentations, drugs.com and webmd.com, but I find these two websites very user-friendly and good to refer your clients to. The last website, shape.com, I got a lot of my information from this website. You may or may not want to refer your clients to this website. It's a little bit more involved than the other two. Anyway, this concludes my presentation of Adderall. Thank you very much.